Hello, my name is Katie Roders Turner, and I'm the Executive Director of the Family Healthcare Foundation. And I'm thrilled to present our presentation, Navigating Healthcare in Hillsborough County. For this training and presentation, we are generously funded by the Children's Board of Hillsborough County to share information on affordable options for healthcare for Hillsborough County residents and for professionals who are assisting families in Hillsborough County. The Family Healthcare Foundation is a nonprofit, and we've been working in Tampa Bay for over 25 years. And we have a vision that everyone in Tampa Bay has affordable access to high quality healthcare coverage. And we really want to be a leader in ensuring that everyone has access to that coverage. Through our work, we have navigators across Tampa Bay and specifically in Hillsborough County that help anyone complete applications one-on-one to understand what options are available to themselves, their families, and children to get access to affordable healthcare services. We do that through application assistance, and we also do it through outreach and education. And here's a couple pictures of our team in Hillsborough County. As I mentioned, we're generously funded by the Children's Board of Hillsborough County, and this training is for professionals or those becoming professionals who will serve those in Hillsborough County. And so at this time, I ask that you open up your camera apps on your phones, look at the QR code, hover over that, and open up a web browser, which will take you to our pre-test survey. Now, if you don't have a cell phone with you, no worries. Open up a new internet browser on your computer and go to tfhfpretest.org, and you can pause this video while you do that to ensure you have enough time to take the survey. If you don't know the answer to a question, don't worry, we're going to go over it here today. And there will be a post-test. And if you successfully complete both, you will get a certificate of participation for this training. At this time, I ask that you pause the video to ensure that you have enough time to complete the survey. Thank you so much for doing that. We'll go ahead and get started with the rest of the presentation. So we know that many people may be confused about healthcare coverage and how to navigate their affordable healthcare options. And that's why the role of a navigator is so important. Navigators are trained by the Centers for Medicare and Medicaid Services. We have to be registered with the state of Florida to ensure that we have a level 2 background check on file and to verify that we cannot be biased or funded by any insurance carrier. We also have to remain conflict-free and objective and tell everyone what all of their options are. In recent years, our area has certainly been impacted by the effects of the COVID-19 pandemic and continuous coverage mandates. At the start of the COVID-19 pandemic, there was a pause on all Medicaid redeterminations for Medicaid recipients. And then it lasted for a few years. What that meant was that in Florida, over 2 million new people gained Medicaid coverage between March of 2020 and March of 2023. That was more than 50% of children to a total of 5.5 million individuals. Florida Medicaid coverage redeterminations began in April 1st of 2023. And so what that meant is that every single person would have to have their Medicaid coverage redetermined. So over 5.5 million people, either actively redetermining their own Medicaid through applications or through other back-end system processes. The redetermination process lasts for over a year. And during that time, over 1.5 million Floridians lost their Medicaid coverage. Many of those who lost coverage were due to no longer being eligible for coverage. Maybe they had a household change or an income change. And so the information I'll share with you today is about what other options do people have for affordable healthcare coverage in Hillsborough County. Programs we're going to talk about today are Florida Kid Care, the state's health insurance for children. Talk a little bit about Florida Medicaid for adults. the health insurance marketplace, the federal government's platform to shop for insurance and apply for financial assistance. And then finally, Hillsborough County Healthcare Plan, which is a great program for those in Hillsborough County who are lower income and lower assets. First up, Florida Kid Care. So this is the state of Florida's health insurance for kiddos, sometimes referred to as CHIP, Children's Health Insurance Program. This is composed of 4 different programs: Medicaid for Children, Medikids, Florida Healthy Kids, and the Children's Medical Services CMS plan. And that's specific to children with special healthcare needs. Where a family has their children in the programming is dependent on a few variables. One would be the age of a child, and also then the household income and number of people in the home. And the household income and number of people in the home is what's used to determine a family's federal poverty level percentage. This slide is the Florida Kid Care quilt, and it shows along the bottom the age of a child, 0 through 18, and along the left-hand side, vertically, where a family's federal poverty level percentage is. And you can see across this quilt that depending on the age and also the household FPL percentage may determine then where a child is and what program they are in through Florida Kid Care. There is a Medicaid component, there is a subsidized coverage option, and then finally there is a full pay option as well for families who don't qualify for subsidized coverage. These are examples of the household size and then also household income, which is used to calculate the federal poverty level percentage, and then showing where a family may be in a Florida Kid Care program. So for example, children in a household size of 4 with household income up to $41,496 may be eligible for Florida Medicaid. That same family, household size of 4, up to $62,400 in income annually, may qualify for $20 a month subsidized coverage for all kiddos in the home. And finally, that same family with over $62,400 would qualify for full pay Florida Kid Care. Of children who are uninsured in the state of Florida, most are eligible for healthcare coverage through Florida Kid Care. Now, to be eligible for Florida Kid Care, you do have to be a Florida resident, meaning you will need to apply once you are determined a resident of the state of Florida. You have benefits in the state of origin if you've recently moved. Benefits should be closed out in that state before applying for Florida Kid Care programs. Kiddos will need to be a U.S. citizen or have lawfully residing immigration status, and there's a long list of those. Children should also be under the age of 19. And as I mentioned earlier, eligibility is based on a family's size and adjusted gross income, which makes up the FPL percentage, federal poverty level percentage. And that's a common calculation that's used to evaluate and provide eligibility for many public benefits. Now, from checkups to transplants, Florida Kid Care is incredibly comprehensive. It meets the standards of the Affordable Care Act. It provides access to health and dental services with 0 or very low co-payments. It covers surgeries, immunizations, vision and hearing, emergencies, hospital stays. In legislative news, in the spring of 2023, the Florida legislature did expand or provide approval for an expansion for subsidized Florida Kid Care. Unfortunately, this time that has not yet been implemented due to some administrative barriers. However, we're very hopeful that that will be coming soon in the near future to allow more families access to subsidized kid care. We'll move over to Medicaid, and we're going to be talking a lot about Medicaid for adults. In the state of Florida, most adults are not covered by Florida Medicaid. And of Medicaid recipients, most of those are not adults either. You would need to meet, in order to be eligible for Medicaid, a category in addition to income eligibility. So we'll briefly talk about parents and relative caretakers of children, children themselves, which we've covered, pregnant women, former foster care individuals, and then non-citizens with medical emergencies. So there are varying income maximums that someone could have for their household income and still qualify for Medicaid. An adult or a parent, a caretaker who's a relative of a child in their home, the maximum that that household can earn to have the adults covered by Medicaid is 33%. Pregnant women, up to 185% of the federal poverty level. We spoke a little bit about kiddos and Medicaid. So children newborn to age 1 year, their household can have up to 200% of the federal poverty level. But when they turn 1 year, that drops to 133%. And then former foster care individuals and then non-citizens with medical emergencies. Those individuals will be covered by Medicaid. However, the non-citizens with medical emergencies would only be for the period that they're in the hospitalized, and former foster care individuals only up to age 26. There is a program called Medically Needy Share of Cost, which is a safety net program. So if someone is in a category that meets eligibility for Medicaid, but their income is over the federal poverty level maximum amount, those individuals may qualify for medically needy share of cost. So that acts similar to deductible. There would be an amount for those individuals in the home. And once that allowable medical expense is met, that individual will be eligible for Medicaid for the rest of that month. Now, many people who qualify for medically needy share of cost could also qualify for other programming that would provide comprehensive care in addition to the safety net that medically needy offers. One of those could be the health insurance marketplace, and that's the federal government's platform to shop for insurance and apply for financial assistance on healthcare.gov. Healthcare.gov is the only website that navigators will help people assist with applications, and that the only website that we will refer people to shop for insurance. There are other lookalike websites, but if it doesn't end in .gov, we will not be using it. Open enrollment is the time of year where everyone can look at the marketplace and shop for insurance, and that's from November 1st through January 15th. We always encourage everyone, even if they're currently in a marketplace plan, to update their information to ensure it's as accurate as possible, and so that you can see all options for affordable coverage. We mentioned that many people lost Medicaid coverage during the Medicaid redetermination process. For those who lost coverage, most were predicted to losing Medicaid eligibility, could potentially qualify for enhanced marketplace, health insurance marketplace, advanced premium tax credits, which is the financial help to reduce the cost of premiums. In very exciting news, an issue that had been a problem for some people in the past called the family glitch was fixed in December of 2023. The 2013 ACA implementation rule previously was interpreted that employees who had an offer of employer coverage that covered their spouses and dependents wouldn't be allowed to use their household income on the marketplace to get coverage for their family members. And that is no longer the case. Now they are able to look at coverage for their families, use the household income to see if spouses and dependents could get qualified for additional coverage. This is a slide from our friends at Florida Voices for Health. And what this shows is that in the state of Florida, as we are one of the 10 states who have yet to expand Medicaid, there is a bit of a gap still for those who are eligible for Medicaid and then those who are eligible for the marketplace subsidies. You do have to earn at least 100% of the federal poverty level, which is calculated based on household size and household income, to qualify for marketplace subsidies. So we have quite a few people in the middle of that and the gap who are lost without options for affordable healthcare coverage. Thankfully, here in Hillsborough County, we have a wonderful program called Hillsborough County Healthcare Plan. This is a comprehensive, no-cost managed care program only for Hillsborough County residents who have limited income or assets, who don't qualify for Medicaid or for Medicare. They can still qualify for medically needy share of costs, and as long as they don't have full Medicaid, Hillsborough County Healthcare Plan is a wonderful option for them. This is the income criteria, the maximums that people can earn based on their household size and household income amount. So a single individual can earn up to $26,355 as of September 2024 and still qualify for Hillsborough County Healthcare Plan. There is an asset limit, and that could be reviewed at the time of application. As I mentioned, they cannot be eligible for Medicaid or Medicare, and they can apply at any time throughout the year. And that's actually true of Florida Kid Care too, which I didn't mention before. An exciting news for Hillsborough County Healthcare Plan. There was previously something called the 3 strikes policy that was evaluated at the time of application. That is no longer in place. That was overturned in 2019. Hillsborough County Healthcare Plan also offers vision, mental health care services, and dental services as well, making this a very robust and comprehensive plan for its members. Applying can be done online, as well as all document submission that would be required for eligibility. Now, for Family Healthcare Foundation, we're going to assist everyone with whatever application is going to get them access to affordable healthcare coverage, and make sure they understand all of their options and let them choose which plan or program that they apply for if eligible for a few. If for some reason we are unable to help someone with an application because they do not meet the criteria for that application for eligibility, we will do everything we can to connect them to affordable healthcare services at federally qualified healthcare centers or independent free charitable clinics. Thanks so much for going through the Navigating Healthcare in Hillsborough County presentation. We are going to do our post-test now. So just like before, I ask that you pause the video, open up your camera app, hover over the QR code, or if you need to, take the post-test at tfhfposttest.org. Thanks so much for doing that. I really appreciate everyone, and hopefully this is going to result in a certificate of participation in your inbox. To close out, Family Healthcare Foundation navigators and our partners at Baycare, Tampa General Hospital, Premier Community Healthcare, and Evra in Pinellas have appointment availability year-round. And we really want to ensure that we are a trusted leader, making sure that everyone has access to affordable healthcare coverage. If you go to our website, www.familyhealthcarefdn.org, you can use your zip code to search for an appointment to meet with a navigator virtually or in person. And if you're active on social media, please feel free to find us on Facebook, Instagram, and LinkedIn. We love a follow. Finally, here is our phone number and our website. We'll take calls answered by live navigators, and those navigators speak English, Spanish, Portuguese, and Creole. Thank you everyone so much for your time today, and have a great day.